Gastrointestinal issues are often overlooked and symptoms go often ignored, but they affect 70 million Americans, result in 472,000 deaths, and cost the healthcare system a whopping $100 billion annually. Digestive diseases are not only on the rise, but they disproportionately affect the African American community, so early detection is more critical than ever. Joining us to discuss this issue is Dr. Anshuman Chawla from GI Partners of Illinois. Dr. Chawla, good morning and welcome to WVON.
Thanks, Rufus. Hi, Dr. Chawla. I'm glad to be here.
Good to have you. Can you start by explaining what gastrointestinal diseases are?
Sure. So, a lot of patients have GI problems. We call it gastrointestinal or GI problems, stomach issues, if you will. So really anything related to the digestive system. So that starts with heartburn and acid reflux. It goes on down into your stomach with any kind of abdominal pain, digestive issues, bathroom issues, so constipation, diarrhea, and bleeding. And sort of also in that digestive space also includes the liver, and so any kind of liver problems, hepatitis C, etc. So quite a bit of many conditions that sort of fall under this umbrella.
Well, it seems like it's all the way from your mouth to your anus, from the time anything comes in to the time
That's exactly right. Yeah, you got it.
Including everything that gets touched in between, as you mentioned, the liver, the pancreas, the gallbladder. What are some of the most common conditions that people have related to GI?
Yeah, so I think, we see a whole host of things that most commonly it's the, heartburn and acid reflux, which is so much related to what we eat and our lifestyle. And the other issue that we really see a lot of is what we call irritable bowel syndrome, or IBS. And IBS is irregular bowels, some increased gas, bloating, constipation, these kinds of symptoms. So those are the most common, but of course we see other conditions which are inflammatory bowel disease, ulcerative colitis, Crohn's disease, and we do a lot of screening. So screening for colon cancer, colonoscopies, we do quite a bit of that as well.
Irritable bowel syndrome. That just sounds bad. Everything about that sounds like it's messed up. Why do they call it heartburn? Why is acid reflux called heartburn?
So the general and the more global term that we use is GERD. So GERD is gastroesophageal reflux disease, and the most common symptom that one would have with GERD is heartburn. And so the acid in your stomach comes and kind of refluxes back up into your esophagus, which is behind your chest, and you get a burning in your chest after eating certain foods or after you lay down at night and you feel some burning in your chest. And initially, years and years ago, people thought they were having a heart attack, and so that's where the symptom and the terminology came as far as heartburn, because people were mistaking their symptoms for a heart problem as opposed to a reflux or a GI problem. So that's where the term heartburn kind of came along, and so now we just broadened the term to GERD, and again, it includes heartburn, but it can include stomach pain, it can include trouble swallowing, sometimes a cough, that kind of thing, nausea, vomiting. That's all part of GERD, essentially.
Got it. And pancreatic diseases are included here, too, including cancer. Why can't we figure out something faster, Doc, to understand when we have pancreatic cancer before we get to the fourth stage?
Yeah, that's still an unfortunate part of the diagnosis, is that the diagnosis is made, usually it's too late. There is no good screening mechanism. We don't have an ability to do a certain test earlier in someone's lifetime, to say, okay, you're 40 years old, let's do a scan, and every 5 years we're going to do a scan of your pancreas, and try to catch something at an earlier stage. There's no blood test that we can do that would catch this at an earlier stage either. So, unfortunately, it's still the case. Now, we do have a lot of technology that we have as far as treatment and ability to intervene even when the diagnosis is made, both with surgical procedures and, of course, different types of chemotherapies. So we do have treatment options, but it's good question, and unfortunately, in that small space of pancreatic cancer, we're still behind as far as trying to diagnose it at an earlier stage.
Yeah, I hope we catch up, because this is one, anytime, of all the cancers that we hear, and I know that there's a lot being done in research, there's a lot being done in trying to work with it. This is that one that just seems to be daunting. So whenever you hear it, it just is heartbreaking at each and every point, and most of us know someone who we've lost to that. So keep up the work.
You're right about that.
Yeah, keep up the work. What are some of, I know both it's interesting that constipation and diarrhea, two opposite things, are both part of these GI conditions, but again, if it covers everything from the beginning to the end, then it covers that as well. What are some of, what are functional GI problems, and what are some of the most common causes of GI issues?
So we come to the diagnosis of irritable bowel syndrome, which is sort of a functional condition. We come to that diagnosis after we've ruled out everything else. So if someone says, I'm having these irregular bowels, or I have some stomach pain, we don't come and say, well, you just have a functional disorder, eat better and do these other things. We really like to make sure that we're not missing anything else. Do you have ulcerative colitis? Do you have Crohn's disease? Anything else? H. pylori is a bacterial infection that occurs in the stomach, which can not only cause stomach discomfort, but can also lead to stomach cancer. So we do the full workup, make sure that there are not other treatable conditions. And once those have been ruled out, and now we're just, okay, you know what, you've got these irregular bowels, then we focus on diet modifications, exercise, weight loss, and then sometimes we have to add stool softeners, laxatives, and then there's even prescription medications to help the bowels move a little bit better. So it's a very common problem, but the diagnosis first has to exclude all the other things, and then we focus on the functional disorder.
So is that typical in medicine? Because it seems like it, Dr. Chawla, that the decision is to try and rule out everything else and then determine this is what it must be after you've ruled out all the other things.
Yeah, it is true. You want to rule out the serious things. So if someone has heartburn, we'd say, well, just take an antacid medicine. But at some point, you also want to make sure that they don't have esophageal cancer. So, we don't want to just keep treating heartburn with antacids if there's something more significant down there. So I think the workup is still important. That's sort of our responsibility as the healthcare community, is to make sure that we're not missing the bad things. And then after that, whatever we can do to improve someone's quality of life, if they're living with heartburn or these bowel issues, then, that can impact how they function through the day. And so we try to improve all of those things as well.
So I want to run through the things that I have, that these are some of the things that we can do that try to help us not have GI problems. But it appears that if we eat a diet that's higher in fiber and fewer processed foods, if we get more exercise, if we consider how traveling and other changes in our typical routine will impact our bodies, stress and anxiety are always bad for us. And this is an interesting one. Holding your poop or not going as soon as you need to go. So when you need to go, when you got to go, you got to go. Don't move otherwise. Certain medicines are going to impact the GI system. Pregnancy and menstruation will also impact the GI system. And sometimes it's simply eating foods that don't agree with you.
Yeah, that's a long list, but I think you can really just, again, lump these into what we call lifestyle modifications. And so starting from the diet, over time, processed foods are bad. We know that. So you have to limit those. Eating more whole foods and foods that are high in fiber are better. They keep the gut moving better. And foods that, the latest thing people have been talking about are probiotics. So, there are foods that naturally have what we call good bacteria that can improve the gut health and, again, keep you regular and generally make you feel better. Probiotics are found in foods like yogurt and kefir and other fermented foods, but some people just don't get enough of that, and so they add a supplement. You can always get probiotics in a pill form, and just add that to your routine, and that can help keep the gut healthy and keep things moving a little bit better. But movement, so exercise, daily exercise, even walking is if you're walking and your body's moving, then your gut's moving as well. Making sure you're drinking plenty of water. They sound all like simple interventions, but they really do make a difference. And when we drill down into it, we find that most people are lacking in all of those things. They're not eating enough fiber. They're not drinking enough water. They're not exercising. And then all these things add up.
Yeah, I believe that, because good and bad habits do add up and can cause some issues no matter where they are. Before we go to break, though, I want to ask you about colon screenings and colonoscopies, which you mentioned earlier on. One way to catch these symptoms is by getting a colon screening. What does that consist of?
Right. So, we're still in the month of in February, which is Black History Month, but we do know that in America there is a disproportionate higher incidence of colon cancer in the African American community than in the Caucasian community. The reasons for that are multifactorial. Some of that is, you could say it's genetic, but it's probably more related to socioeconomic factors and access to health care. So colon cancer, there may be a higher incidence in African American community, but what we recommend is talk to your doctor. Get into the healthcare system, communicate with your doctor, and when it's time to have your colonoscopy to check for colon cancer, you have to get it done. The recommendations today are that at age 45, both for men and for women, you start having colonoscopy. And, most people don't really feel like, well, I feel fine, I'm eating okay, I don't have any stomach pain, what do I need a colonoscopy for? But that is exactly the time when you should have a colonoscopy, is before any of those symptoms occur. That's what a screening tool does, is it does looks for something before the problems occur. And so there's a little bit of a process to get screened for colon cancer. Colonoscopy means you got to get cleaned out, which is why most people don't like to do this procedure. But once you get through the prep, it's a fairly straightforward thing. And what we're doing and what we're looking for during a colonoscopy are these small little polyps. And so polyps don't have any symptoms. They don't cause pain. They don't cause bleeding. But during a colonoscopy, we can remove them and essentially prevent colon cancer from occurring in the first place. So there's still a lot of benefit, and the month of March coming up is Colon Cancer Awareness Month. And so you and your listeners may be here seeing more advertising on the Get Your Colon Screened. It's Colon Cancer Awareness Month. But just the first step here is talk to your doctor, have them screen you for everything. You should be getting your blood pressure checked and your diabetes stuff and your blood sugar, the prostate, the mammogram. Also included in that screening is your colon and colonoscopy. So it's very important to have it all done, but it starts with education, and it starts with keeping in touch with your primary doctor.
Yeah, the cleansing out is tough, but you feel better once you've done it, and it's always good to do and good to know what the impact of all these things are. We're talking with Dr. Chawla. He is with GI Partners of Illinois, a physician-led network of independent gastroenterology practices providing advanced patient-centered digestive care across Chicagoland. We'll have more with the doctor, answer some of your questions right after this. Welcome back. We are talking with Dr. Anshuman Chawla, talking about GI and digestive issues. And Doc, I have to go back to a couple things we've spoken of. When we went through the list of things that may cause GI issues, I didn't include fried foods in that. Is that a thing we should be concerned about?
Sure. Again, it's all about the diet, and processed foods, fried foods, sugars, carbohydrates. These are all things that we should consume, but we should really consume in very small quantities. And instead of those items, we should focus more on whole foods, fresh fruits, fresh vegetables, things that are made at home with the proper oils. So even if you are cooking with a little bit of oil, it should be more of an olive oil as opposed to a canola oil. So unfortunately, the fast foods they're quick, they're easy, you're on the road, but they're not good for you. That's just quite simply. But they not only can add to your GI problems, but they can add to your blood sugar problems and your blood pressure problems and your weight problems and all of those things. So it's all tied together for sure.
Yeah, and this wasn't necessarily part of the GI issue, but it hits you between mouth and bottom. Kim is asking, what foods give you high cholesterol?
Red meat. So really,
can't be. That just moved to the top of the pyramid.
Well, so it's a combination of things. So the meats are at the top of the pyramid because of protein. We need to focus a little bit more on getting protein in the diet, and that in combination with fiber, vegetables, and fresh fruits. And the other things that are now moved to the lower part of the pyramid, which are the bread, carbohydrates, and sugars. That's why that the pyramid has been flipped. So protein is really more important, and getting it from non-red meat sources. Red meat is okay in smaller quantities, but it's the protein that is really what's focusing on that top end of the pyramid. What can add to cholesterol? Where does cholesterol come from? Eggs and red meat. So that's some cholesterol is good for you, and a lot of cholesterol is your cholesterol level is based on genetics also. And so I think what's important, as I said earlier, you can't guess what your cholesterol level is. You have to see your doctor. You got to get it checked, and work with your physician on maintaining the healthy level of cholesterol.
On that point, Doc, and I mentioned earlier that you're part of GI Partners of Illinois. What are the benefits of going to an independent practice like yours versus going to a large hospital system?
Yeah, we are GI Partners of Illinois, and you can find us on our website. It's just spelled that way, gipartnersofil.com. And we are a large group. We function like a big hospital system, but we are independent. We're not employed by the large hospital systems within the Chicago area. And so because we're independent, I think we have a few less layers of bureaucracy. So when you try to call and make an appointment, that's the first step. You're calling a number and you're talking to my staff right away. You're not going through some big call tree. And when you come to any of our offices, you're generally going straight from the waiting room to the doctor. You're not seeing the nurse practitioner or the MA. It's a very old-fashioned mom-and-pop type shop, and I think that helps patients relate to the doctor. And again, access to healthcare is so important. But when you have that relationship one-on-one with the doctor, as our independent practices allow, I think there's a better chance that the patient's going to have a better outcome because they're going to trust the system a little bit better. Great.
I've got a caller who wants to get into the conversation. Andre, good morning. Welcome to VON. What's on your mind this morning?
Yes, good morning to the guests and good morning to the crew. Doctor, I'd like to ask you this question about the gut as of the plastic cancer. It's my understanding that if you drink your drink too hot or you eat your food too hot, that it could cause some sort of cancer, some sort of problem. Can you break that down to me and tell me if that's true or not? Thank you very much.
Thanks, Andre.
Sure. So we're talking about gastric cancer, and to start off with gastric cancer, there is a higher incidence of gastric cancer in the African American community versus the non-African American community. So, it's definitely something to talk about. The risk for gastric cancer is related to an infection in the stomach more than the temperature of the drink that you're taking. So you may have heard of a bacteria called H. pylori. H. pylori is the main risk factor for gastric cancer, and so that's something that can be tested for either by a blood test, a stool test, or a endoscopy, a scope test where we put a camera down into the stomach and check for that bacteria. But once that bacteria is identified, it's very easy to treat, and once you treat and eradicate the infection, the risk for gastric cancer goes down significantly.
Dr. Chawla, thank you so much, and thank you for all the information that you shared with us today. It's Dr. Chawla, CHAWLA. He is at GI Partners of Illinois. Go to GIPartnersofil.com. healthofil.com to reach him and for more information. Dr. Chawla, again, thank you for being with us this morning.
Thank you.
All right, be well.